This is an interesting market because when you look at products and you think about consumer, right, you either have followers or fanatics. And we all know we want fanatics. And I use fanatics in a really mission driven way, not in a crazy fanatical way. And so you've got a market that has no idea this solution exists. And then you've got the ability to scale this on social platforms where I don't know exactly what the percentage, but I think a majority of users on Facebook are females. And a majority of them are females above the age of 50. And so now, for where do you burn through your money? You burn through your money in clinical trials when you're going for a device, right? You burn through your money on a sales force. Those are the two big burns. You don't have to worry as much as the standard medical device because you've got a built-in market, and your market's really easy to address because they're sitting on a social platform. What you've got to do right now is just train more doctors, make more devices. And so I still am not understanding why this is not attractive from a venture capital perspective on this. And again, I'm asking that question again. Are you out for financing right now? What are you looking for financing, and where will it get you? So I want to toss that out there to both of you. I don't know if Deb, you want to go with that, or Renee, you want to go with that?
Sure.
Deb, you go first.
Yeah, go ahead. So, we have an incredible opportunity in front of us that we are in launch mode right now. We are setting out 20 or 30 hospitals that are already using the device, and we have another 30 or so in the queue. So we are ramping quickly, and we are raising a round B to help us ramp. That would, of course, be manufacturing, making sure we have enough inventory as we ramp, and maybe even ramp sooner than expected. We want to also then commercialize outside the United States, and we want to make sure that we can back all that with the consumer marketing plan. So that's primary use of proceeds for the round. And this actually could take us to a break-even scenario. So we are, very excited about that, and potentially maybe the last equity round for the company.
Exciting.
I think to your point, Joe, though, because your question is why are investors not like fighting each other, right? To throw money into this small company. I think some of it's inertia, habit. But I do think you hit on something that's unfortunate, but part of the thinking, and that is, traditionally speaking, women's health exits have not been big. And if you start with a misconception that this is a niche market, which I'm here to tell you it is not, and then you look at exits, their dollars are competing too. If they think, this exit's going to be, small in their world versus another one that they could invest in that's going to be 5 or 10 that, it's math for them. I think another thing that you said that I think is going to be important is at some point we have to get rid of old habits and invest because it's the right thing to do, and then the math will come. Mm-hmm. The math hasn't, I can't name too many billion-dollar exits in women's health. And so I do think that gets in the way sometimes.
Yeah. And one of the things I'll take us out with here, and this is my challenge to the market, and there's a lot smarter venture capitalists and really private equity on this, is look, here's to all my PE friends out there, and you know who you are. I deal with you all the time. And here's the smart play. You're worrying about an exit. Let's forget about exit. Let's look at cash flow. Let's go circle the globe on cleared or nearly cleared or low lift products in fem health. Let's do a roll up. Let's then take that roll up and only employ a female-based sales organization. Stay with me. Private equity, you're already investing in real estate, in ambulatory surgical centers or alternative sites of care. A woman does not want to go to a hospital because in her head, it's an intimate procedure. So why would you not invest in the real estate in ASCs or alternative sites of care for female health? Why would you not get a bargain on all of the cleared or near cleared devices? Why would you not put together a female sales force or use the telehealth solution and keep the sort of in-home experience up until the procedure? So for the private equity firm that takes that on, I want 5 points on it just for giving you the idea. And you should look at FEMSelect for sure. Ladies, anything before we head out from today's session that we didn't talk about that we should have?
Well, I would say, Joe, you just laid out our dream. But this is a good point. There are a lot of people out there talking about a women's health roll up. Put your money where your mouth is. What you just laid out is the perfect solution. It makes mathematical sense. It makes sense for the investors, and it makes a heck of a lot of sense for women. But we need to stop talking about it and start investing in it.
Agreed. Deb, any
I
last
would
words
just
from?
add one other comment. I know it's kind of a new topic at the end of our discussion, but we're also a female-led company, and we're led in a unique way with co-CEOs. It's really a unique opportunity, but it works really well. We've actually had some investors kind of query us about that, and often even joke that if we were men, maybe it wouldn't work. We cover different geographies, we cover different time zones, we have different perspectives, and so we can complement each other and bounce ideas off each other, and we see it working very successfully. So I think that's another point to consider. There's many statistics on female-led companies, if not outpacing, then at least matching what other companies do. So.
Agreed. And I'm probably going to want to bring you both back on another session I'm having on female-led CEO organizations and what's the pros and the cons of it in the market. But point taken for sure.